I'm Debbie with the Wellness Committee, and thank you so much for coming. We're going to talk about staying in independent living, which is a real goal for some of you. Others moved in here to move through the levels of care, and that is discussed, and that's an option. But for some people, they never want to move out of independent living. So that's what today's talk is about. If that's your goal, how can Robin help make that happen for all of us? And my goal is for you to get to know Robin better. You think you know her, but I asked her, I said, what do you do? You know, it's like this huge job, but I asked her to kind of categorize it. And she said she goes to meetings to work out problems and figure out solutions. She spends time connecting with people to get to know them. And then she spends time documenting. If anyone's in healthcare, you understand if you didn't document, whatever you did wasn't done. So documentation's part of it. So there are really three parts of Robin's job. And where do you think she spends most of her time? Documenting, in meetings, or connecting with people? So, who says documenting? Who says connecting with people? And who says in meetings? So most of you think she spends most of her time connecting with people, which of the three is her favorite thing to do. But just because of healthcare and the fact that we have hundreds of people in independent living, she winds up spending most of her time documenting. And that's where healthcare is now. So when you see her in her office madly on the computer or paperwork, she's doing what she has to do, which is her least favorite of the three things. But she's doing what she has to do so that if Robin gets hit by a train tomorrow, someone else can pick it up and it's all there. So we're glad you're here. She is doing what she likes now. I don't know about presentations, but connecting with all of you and getting you to know what she can do for you. This is a joy for Robin. So thank you so much for coming. And does everyone have a cell phone? Are the ringers turned off? Just give them a check. Thanks so much. Let's welcome Robin because she's the one that can make a difference to all of us.
Thank you, Debbie. So presentations probably aren't my favorite thing to do, and I think we learned that at my last presentation where we learned that I'm an introvert. So I do have to psych myself up to do these. They're fine. I do them every year, so it's not as big of an issue as it used to be when I first started in this position. The documentation, a lot of it is if there's an issue with a resident, if I have a conversation with you, if I have a conversation with your family, if there's an issue going on, I'm documenting those issues, I'm documenting those conversations so that we have a plan for you. So if something happens, we're documenting that so that we can make changes, we can offer guidance, we can offer suggestions on how to help you. Also, I'm documenting when you do your yearly medical history updates and you return those to us, we have to document that into the computer. So I'm sitting there entering all that information into the computer so we can get it back to you and put it in your refrigerator. So yes, there's a lot of computer inputting that I have to do to keep y'all safe in your apartments. Meetings, yes, I have to go to them. They're not my favorite. Probably most meetings could be handled through an email, but I have to attend them. So today we're going to be talking about staying in your apartment as much as possible. There are times when residents do have to go through the levels of care. Some residents move into Westminster, as Debbie said, and their goal is once they're unable to take care of themselves, they're ready to move through the levels of care. That's why they bought into Westminster. Some residents move into independent living and their goal is to stay in their independent living apartment as long as possible, maybe until the end. Some people have the resources to be able to do that and some people don't. So my goal, my job, is to learn what your goals are and what you want to do. So that's another facet of my job. So this presentation is kind of that what if. You have questions, what if this happens, what if this happens, what we can do to help you if things happen in your life. So, my name's Robin Gonzalez. We've talked about I got married a year ago. I've been here at Westminster, I didn't put that slide in this one. I've been here at Westminster a little over 13 years, started out in the healthcare center. I have a bachelor's in social work, a master's in nursing in maternal health and public health. I came to Westminster for interview experience, and Chuck hired me after an hour-and-a-half interview. Thought I would be here maybe a year just to get some experience. Worked in the healthcare center about 6 years, then moved to independent living, and I've been here in independent living a little over 7 years. So I think I've kind of found my calling. Maybe? I don't know. There are challenges and there are days where I'm like, why do I do this? Why? And then I'm reminded why I do it. The residents who really appreciate everything I do, even the ones who don't appreciate it, I like breaking through. I think that's when I feel like I most succeed, is the ones who are really grumpy and the ones who don't appreciate it, and then that one day where they say thank you, that's when I feel like I've succeeded. Because people can say thank you every day, and then it's just the one that is so grumpy every single day and just don't appreciate anything you do for them. The one moment they are thankful for something that you do for them, that's what really gets to me. So, here I am 13 years later. Never thought I'd do it, but here I am. So, we're going to talk about information pertaining to independent living, your changes in your health, personal caregiving services, therapy, pets, emergency, higher levels of care, and resource guides. Some of the information is kind of rounding up some of the information from other presentations, but it kind of puts it in categories. The other presentations, it's kind of like random information. This is how it pertains to you, how you use that information, how, if you're going through, and you'll see once we get to it, if something happens to me, how do I take advantage of that amenity here at Westminster? So we're going to start with this. What if I'm having primary care doctor issues? So at the beginning of this year, we had several residents whose doctor retired or went concierge. So then they didn't have a primary care doctor, which every resident should have a primary care doctor or some type of primary care physician. So if you change doctors, please let us know right away, because we do work in conjunction with your primary care doctor, whether that's getting orders for therapy, or if you've got some illness going on, we do work with your doctor. If we need to get labs, if you've got a change in your health, we need to know who's providing your care. If your doctor is retiring or going concierge and you don't want to go that route, we can provide options. If you're no longer driving, we can give you options that our drivers can take you to. We also have a doctor here at Westminster that sees Westminster residents. We used to have 2, but because of the changes in our healthcare center where we now do outside rehab, one of our doctors is focusing on that a lot. So he's not seeing IL residents as much anymore. So please let us know if your doctor changes. We will change that on your face sheet. Do y'all know where your face sheet is located in your apartment? Where?
Refrigerator.
Yeah, what is that called? That's in your refrigerator. your vial of life. So if there's an emergency in your apartment, that's where the nurse knows to go to get that emergency information. So if a nurse goes to your apartment, they know what doctor to contact to give the incident report to. So it is important to let us know when your doctor changes. Also, if say you get diagnosed with cancer or you get a neurologist, I don't really need to know if you're dentist or if you have a subspecialty, but if you have like a neurologist or an oncologist because you have a brand new diagnosis, let us know who that doctor is, because we may need to consult with them. Our clinic may need to consult with them too. So what if you have a sickness, an illness, or an injury? So I know this is small. We're going to post this on the portal, and then it's being reported, so it'll be posted on the portal also. But you can see your doctor, or you can go to our clinic. Our clinic is open Monday through Friday, so you can get an appointment in our clinic. You can certainly push your pendant or pull your pull cord. A nurse can come see you if it's Monday through Friday. We can get you an appointment in the clinic. If it's after hours, then a nurse can come see you and provide some advice. If you do have a severe sickness or a severe injury, we can certainly send you to the hospital if needed. If you are not feeling well, you can hire someone to assist you. We could get home health involved, so that's where an outside agency comes in to provide services to you, or we could do wellness checks. If you have the flu, COVID, or some other contagious diagnosis, should you walk through the halls, walk to my office, walk to the clinic, and say, I have COVID. I need to be tested. Should you do that? No. Stay in your apartment, please, and call us, and you can say, I think I have COVID, and we'll come see you. Please, if you think you have COVID, you've been diagnosed with COVID, you went to your primary care doctor and they diagnosed you with COVID or the flu or something contagious, stay in your apartment, please. Call us and we'll come to you. We can do free meal delivery while you're in this contagious time. We can do wellness checks on you. Currently, our COVID quarantine is still 10 days. I know that's not what the CDC recommends, but we are protecting all the independent living residents who may have immunodeficient issues, who may not be as healthy as you are, who may, if they get sick, have a harder time recovering. So we're trying to protect all the residents of Westminster. We're also trying to protect our staff. If you are ill and you go to a dining room and you get all the food and beverage staff sick and they have to stay home, who's going to feed you? So we need to protect each other. So that's why our quarantine is so long at this time. It's been successful at keeping the rates of COVID down. Right now, I will tell you, we do have 8 cases of COVID in independent living. Okay, so protect yourself and protect others as much as you can. And the healthcare center, I like to let people know it's not a hospital. So if you are not feeling well, if you fall and break a hip, if you fall and injure yourself, I can't just walk you over there and admit you over there. Okay, we would send you out to the hospital. Then from the hospital, we could admit to the healthcare center. What if you have a planned procedure or a planned surgery? Please let me know if you want my assistance as soon as you know, okay? That way we can plan some things to keep you as comfortable as possible in your apartment. Because there are some things that we can do in your apartment. We can do the wellness checks, we can do the free meal delivery, we can have the nurse practitioners check on you. We can make you as comfortable as possible in your apartment. Not everybody has to go to the healthcare center if they have a surgery or a procedure done, especially if it's an outpatient procedure. We can keep you comfortable in your apartment. So if you're going to have something done, you can call me or you can email me or you can come by. let me know the date of the surgery or the procedure, what type of surgery or procedure it is, the doctor that's performing it, the hospital it's going to be at, and your anticipated length of stay. So it could be a couple hours, it could be a couple of days, it just depends. Just let me know, okay? I put you on my radar list. I let the healthcare center know just in case. Sometimes people go in for a procedure, it turns out to be a bigger procedure, and then maybe we do need to admit to the healthcare center. But let me know so we can make a plan. I'm only as good as the information that you give me. If you don't let me know, so I usually give these two examples. One, we had a resident who had major dental surgery and she didn't tell me. And that night, her mouth started bleeding, so she pulled her pull cord, security came up, and of course security freaked out because there was blood everywhere. So they had to call the nurse had to come over, they almost sent her out to the hospital. If we knew in advance, the nurse practitioner could have seen her, we would have had wellness checks, we could have had a soft diet for dinner, we would have had gauze in the apartment, like we would have done things to prevent that from happening. Another one, a resident went in for a knee replacement. I didn't know they went in for a knee replacement, called me on a Friday at 4 o'clock and said, Robin, I'm being discharged from the hospital, what are you gonna do for me? So Friday at 4 o'clock, I'm trying to arrange transportation, I'm trying to get an ice machine, I'm getting wellness checks, I'm getting a wheelchair, I'm getting a bedside commode, I'm getting a shower chair, I'm trying to coordinate all this when you know how the weeks are. It's crazy, I'm tired. I'm about to sit in MOPAC traffic, all that kind of good. Not that I shouldn't be focused on you. But it's also Friday, it's 4 o'clock, and now the last couple hours of my day, I'm scrambling when we could have planned this in advance and it could have all been in the apartment in advance, okay? So just those two things highlight, let me know in advance. What if something happens outside of Westminster? So say you go out to dinner with your lovely family, or you're traveling. We had a resident who was traveling and they had a major health incident out of state and they had to fly back. The family called me and I helped coordinate that. So I met they flew back on a medical flight. I met the EMS here and then they went to EMS to the hospital. And then I helped coordinate the care. So even if it happens out of state, or if it happens in the evening, call Westminster, have your family call Westminster. If you end up in the hospital, let us know as soon as possible that something's happening so that I can follow up with the hospital the next business day. You can carry my wallet, please don't. You can carry my card in your wallet with my contact information. Just in case. We had another resident who was probably in his 90s and he was traveling to New York. This was a couple years ago and I was really concerned about him. And so I put my card in his wallet and I said, if anything happens to you, please point to this so they know who to contact if anything happens in the airport, in your hotel, anything. So somebody knew where you lived and who to contact if you had a medical emergency. Thank goodness, everything was fine. He came back just fine. But things happen. But please also remember this is independent living. If you go to the hospital, and this happens all the time, when you go to the hospital and the hospital asks, where do you live? And you say, I live at Westminster. And they're like, oh, you live in assisted living? Yes, I live in assisted living. No, you don't. You live in independent living. When they discharge you from the hospital, if you say you live in assisted living, they think you have more care than you do, okay? They think you're going back to more oversight than you do, okay? So you need to know to let them know that you are coming back to independent living. That's really crucial. I will call the hospital when I know someone's in the hospital, and I talk to the case manager, and I'm like, oh, I need to talk to the case manager for Mrs. Smith, and we're talking. She goes, yeah, she lives in assisted living, and I'm like, no. It's independent living. She's got to be able to dress herself, walk, all this stuff. And she's like, oh, that really changes everything. She needs to go to rehab for a little bit. We thought she would have more care. So there was a handout that I had. I only printed 30 copies. If you need a copy, let me know. I'll post it on the portal also. But there's a section in there of things that you should tell the ER or the hospital when you go. And one of those is that you live in independent living. It's got my name, it's got my phone number on it. You can give them that information. They can always call me. What if you return from the hospital and you need assistance in your independent living apartment on evenings and weekends? It's in that handout also that I printed. So wellness checks. We talked about this in my last presentation. So wellness checks is a complimentary program that we have here at Westminster. They're certified nursing assistants. They are employees of Halcyon, but I manage them. Westminster pays for them. They are here 24/7, and they can provide medication reminders on a temporary basis. If you're ill, they can come do vital signs. They can assist you if you come back from a procedure. We can have them check on you just to make sure you're okay. They can bring meals to you. There's quite a few things that they can do. If you're not feeling well, they can take your pet out while you're not feeling well. It's not forever. It's for up to 2 weeks. If we need to tweak that 2 weeks, we can. But they can provide assistance in your apartment. So if you come back from the hospital in the evenings or over the weekends, you can call reception or inform security. They can radio for a wellness aid. We do have a set schedule, so they may already be seeing people, but they'll come to you as soon as they can. If you have a planned surgery and we've already made a plan for you, you'll already be set on the schedule and they'll come see you. Or you can hire someone and call an agency and have someone come and see you. So what if you're needing the healthcare center after surgery for rehab and recovery? So if you're sent out to the hospital and you're taken by EMS or your family, if it's an incident that happens here, I am notified. So security writes a report, nursing writes a report, and then it comes to me and I'll follow up. I call the case manager, I know what room you're in, I'm getting updates on how you're doing, so I do a lot of behind the scene digging into what your diagnosis is, if you broke anything, how long they plan to keep you in the hospital, if they plan on discharging you back to your apartment or to skilled nursing. And then we coordinate with the healthcare center on when that discharge might be. If you're needing skilled nursing, then they arrange transportation, they get you admitted to the healthcare center. If I know you're gonna be there a while, we can move over some clothing, maybe your TV, maybe a recliner, just to make you as comfortable as possible. I attend a daily meeting where I get updates on your progress. And then once your strength gets better, your endurance gets better, and we start planning your return to independent living, then I'm in that process to get you back to your apartment. If you don't get better and you don't get stronger, then we have the discussion about what's most appropriate. Do you need to go to assisted living? Do you need to go to memory care? Or do you need to stay in the healthcare center? So we have that conversation and make a plan for you. So what if you have concerns about your apartment safety? Maybe in your apartment you're just not feeling safe. Maybe you're having a lot of falls or you're tripping over items. We can have therapy evaluate you for safety. So maybe the rugs in your apartment aren't appropriate or they need to be taped down. Maybe you need some grab bars in certain places so we can have therapy go in and do those evaluations. They look for hazards, rugs, cords from lamps, phones, TV. You know, we don't want you to have a light cord that goes from one end of your living room to the other, and for you to trip over that every single time you walk across the living room. We would help you tape it or try to find a plug in a different place so we can do evaluations for that. Maybe you have light bulbs that are out. We can put in work orders to get your light bulbs replaced. Maybe you like collecting things, a lot of things, and so we can help get your apartment in order. Lots of clutter. Maybe we can assist you in finding someone to hire that can help you organize your apartment. If you've had a change in your ability to transfer or walk, we can get therapy to come in to help with that. What if I only need a little bit of assistance? Like just a little bit? So we do have an agency, Halcyon, that because they see so many residents at Westminster, they will do as low as 10 minutes a day of assistance in your apartment. So that's kind of like medication reminders or a quick check. So they can come to your apartment for 10 minutes to see, did you take your medications for the day? Or they can come for 30 minutes and do a shower, or an hour and tidy up your apartment, or something like that. Some other agencies, they have a minimum of 3 or 4 hours. So let's just talk about it. If you think you need to hire someone, let's talk about it. Maybe we need to do wellness checks for a couple of weeks and just see what it looks like. Some people are scared to hire someone because you've been private all your life. And you can't imagine what it's like to have someone in your apartment with you, staring at you, or in your space. So let's do wellness checks and see what it's like. Maybe it's not that bad. Maybe you might find it comforting. Maybe it's scary every time you try to go take a shower because you're scared you're going to slip and fall. And so your hygiene's kind of gotten a little bad because you're scared to take a shower. Well, maybe if you hire someone who's just standing by or sitting in the bedroom while you take a shower can bring you some comfort and provide you a little peace of mind so you're not as scared to take a shower, and then your hygiene gets a little better. Let's talk about it. So short times, assistance with dressing, undressing. Dressing and undressing takes a lot of energy. And when you start to slow down as you age, it can take all your energy to get up in the morning, take off your night clothes, go to the bathroom, take a shower, put on your day clothes, and then you're pooped. And then you find the rest of the day exhausting. Maybe having someone come in the morning to help you get dressed so you're not expending all that energy, then you have more energy for the day. So there are things that we can do to help you be more successful. Longer time, so maybe assistance going to activities or even around the clock care. So let's just talk. That's all we need to do. It starts with talking about what's difficult for you. What if I'm experiencing hearing loss? So we do have audiologists that come. We have 2 mobile providers that come every first and third Wednesday of the month. You would call the provider directly to set up services with them. If you need their numbers, just let us know. The flyers are put out in the elevators a week before the audiologists come. There are phones, amplified phones, talking, caller ID, relay services, and caption telephone services. If you need assistance, let me or Rachel know and we can help you. Also, if you have hearing aids, a hearing aid that you put in your ear, if you've never had hearing aids and you're getting them for the first time, is a foreign object that you're putting into your ear. Your body doesn't like foreign objects put into it. So your body will create earwax to push it out. When your body creates more earwax, then sometimes people can't hear. So maybe you just need your ears cleaned out. So you can make an appointment in the clinic and get your ears cleaned. That's just sometimes people aren't told that by their ENT or their audiologist, so sometimes I just like to tell people that. What if you're experiencing vision loss? So you can purchase magnifiers, brighter lamps, go see your eye doctor. There are larger print items. You can hire someone to read paperwork to you. You can have someone do medication management. So agencies will manage all your medications so they can order, reorder, fill a pill box for you if you're confusing your medications because the print is so small or the pills are so small, they can help you with that. We can assist with apartment modifications. We can get occupational therapy in your apartment. We can look at lighting in your apartment. Sometimes we need brighter lights in there. There's also books on tape. Reach out to Rachel if you want to get involved in that program. You can also, if you have a smartphone, you can ask your phone to do I won't say just about anything. You can ask your phone to do a lot of things. Tell you what the weather's like outside, tell you the news, play you a song, or you can do one of these home devices. They can do voice interaction, music playback, make to-do lists, set alarms, stream podcasts or audiobooks, provide weather, traffic, other information, or some of them control devices in your apartments. What if you're having a physical decline? So we want to set up an appointment either with the clinic or your doctor. Do some labs first. Maybe there's something acute going on. Maybe there's an infection. We can get therapy orders. Maybe they will recommend adaptive equipment like a walker, wheelchair, or scooter if it's kind of extreme. We want to start out with the lowest first. Do apartment modifications, maybe have some adaptive equipment in your home, grab bars or removal of rugs. Some residents do, they have a walker. Westminster's huge. It gets harder and harder to walk longer distances in Westminster. So sometimes residents need to move to an electric scooter or a motorized scooter. You do have to go through therapy training for that and get checked off. They don't just let anybody drive a scooter. If you start running into people or things, then we re-educate you. There are exercise classes here. We can have a possible conversation about assisted living or the healthcare center if we need to, or you could private pay for a caregiver, a personal trainer, or massage therapy. Again, if you're struggling, please come talk to me. If you need to buy some durable medical equipment, like a toilet chair, a shower chair to make things easier. I know a lot of people have a shower and it can take all your energy to stand and take a shower. Maybe you need to sit to take a shower. We can try to get you something for that. If you need a wheelchair or a walker or a hospital bed or oxygen, I can assist you in finding a company for that. If therapy is needed, they can do a screen, and then we can either get orders from your doctor or the clinic can see you and we can get orders. If you go to your doctor and you get a prescription or an order for therapy, you can either bring that to me or you can bring it to my assistant Diane in the clinic. Diane verifies your insurance and then she sends that to therapy right across the hall from the clinic. Then Select Rehab, if that's the company you choose to go with, will reach out to you to set up a day and time for therapy, evaluation, and treatment. So, I'm a little bit involved, I'm not totally involved. I'm not over therapy, but if there's an issue, let me know and I can help address it. They do physical, occupational, and speech. We don't do cardiac rehab or respiratory rehab here. If you're doing outpatient therapy, Select Rehab does it. If you're doing home health and therapy, then Halcyon does all of it together. They can do therapy in your apartment, in the therapy gym, which is right across from the clinic, or they can do a home exercise program. They could do pool therapy, or they can give you exercises to do in the Windsor gym or in the Annex gym. What if I'm losing or gaining too much weight? Again, we want to start with the clinic or your doctor and do some labs. Maybe there's something going on. Speech therapy. Maybe there's something orally going on. Maybe there's a swallowing issue or a chewing issue. They may give a diet recommendation or do a swallow study. We can do a dietary consult. That's a registered dietitian. Will come and talk with you about options. So diet options, food options. The first hour of that is paid for by Westminster. Usually it can be done in an hour or less. If you need to be seen more than that, then it would be paid for by the resident. And then there are different dining room options, and then we also have meal delivery options. What if I'm noticing cognitive changes? Again, we want you to be seen by the clinic or your doctor. The first thing we usually think of if there is a cognitive or a mental change with a resident is a urinary tract infection. If a resident has a UTI, we think that's what we think with a cognitive change. So we want to check a urinalysis because that's a quick fix. We could do an antibiotic and hopefully that can fix things. But if everything comes back clear, then we might think there's other changes. It could be dementia. We could be looking at Alzheimer's. We could be looking at something else. So speech therapy could come in. They could do cognitive testing, help you with memory strategies, and get you engaged in activities. If you're still driving and you have memory changes, there is the outpatient St. David's driving evaluation, so we could get an order for that, and you could go be evaluated just to see if it's safe for you to still drive. Though if you are questioning if it's safe for you to drive, it's probably not safe for you to drive, so it might be time to give up those keys, which makes it so much easier than if you fight it. If you're missing your medications, you're forgetting to take them, you're missing or you're taking too many, you might want to think about doing medication management where somebody else is in charge of your medications. Rachel Gill also does cognitive testing. She has classes, Fit Minds. We could do an assessment for assisted living or memory support. This is Rachel Gill, responsible for meeting resident social, mental health, and cognitive needs, provides resident orientations. If you're feeling lonely or unmotivated to join in, sometimes living in a senior facility, we start losing our friends, and that can kind of make us socially isolate ourselves, or if we lost our partner before we moved in, it can make moving in isolate ourselves. And so you can review our monthly, weekly, and daily calendars. There's so much to do here at Westminster, so take a look at those. There are support groups and discussion groups. Meet with Rachel Gill. She can talk to you about activities, the calendar, make suggestions. She is a social worker, so she can talk with you and kind of get to the root cause and kind of see if you can come up with a plan on how to start joining in or get to the reason of the loneliness. Reach out to me or her. She can do talk therapy. We can get agency or private duty involved. Maybe you live at the furthest apartment that's furthest from every activity that we have. And it's so hard and it's so far to walk and your mobility is getting harder and harder just to join. Maybe we get therapy involved and we do some therapy to get your endurance and your strength up. And then maybe that'll get you more involved. So there are things that we could do. Maybe you need to hire a companion to get you out and get you moving. Maybe you need some vitamin D, get out in the sun. We can talk through it all. If you think it's depression or anxiety, again, we want to do some labs, get you evaluated. We can do some testing. We have a psychologist that comes here. We can get you connected with psychiatry. We have a grief and loss group. We have classes at Westminster Aquatics, walking club, and yoga. Same thing I just said. If you're experiencing grief and or loss. We have that a lot here at Westminster. It is hard. When it's our friend, our loved ones, our spouses that pass away, or even move to another level of care, or it's ourselves and we're losing our independence. Losing our independence is grief and loss. You know, we're not able to do what we used to do. That's a part of grieving. We're grieving our former selves. And so, I mean, this doesn't compare to y'all, but I just had to start wearing readers on Monday. So, I mean, my far vision is 2015 and 2020, but I can't see up close anymore. So I am grieving my up close vision.
Okay.
Yeah, I'm okay. I am. If you're having driving difficulties, again, St. David's Driving Course, we have the little store here, so we have things that you can buy there. There's Uber, taxi, Lyft. We have transportation through our drivers to doctor's appointments, baking, grocery shopping. Again, losing your ability to drive, another thing you can grieve. That's a loss of independence, a huge loss of independence. Some people move into Westminster who haven't driven in years, so it's okay for them. But if you moved into Westminster driving all over Austin and now you don't, and you feel like your world has gotten smaller and smaller, it's a grieving process. So we have a driving and transportation guide. There are delivery services, pharmacies, Shipt, Instacart, HEB. You can have your groceries delivered, sign up online. Amazon, Chewy if you have pets, Favor, DoorDash, Grubhub, you can get anything and everything online. What if I have a pet? Register them in my office. We do a vial of life for your pet, so not only you, but your pet. In case something happens to you, we need to know who to call, what vet they go to, how they like to be fed, someone who can pet sit them, and vaccinations. What if there's an emergency or alarm? We talked about this in my last presentation, shelter in place. We'll give out instructions over the all-call system. If we evacuate, you will know. We'll go door to door, area to area. I keep a list of residents, their needs. I update them every month and send them out to pertinent people. Those that are on oxygen, assistive devices, and who have pets. If the power is out and it's dark outside, try to remain seated or have a seat. We want to prevent falls in the dark. So if you have a flashlight, make sure the batteries work in your apartment. Test them often. What if hospice is needed? So hospice can be done in your independent living apartment. Okay, that doesn't mean you have to move to the healthcare center. Your care is managed by the hospice agency nurses. They can assist with medication and supplies, oxygen, hospital bed, bedside commode, wheelchair, low air loss mattresses. They don't provide 24/7 care though. So if you need someone with you 24/7, then you'd have to hire someone to do that. You can stay in your independent living apartment as long as you are safe and your meds are managed. What if another resident needs assistance? So if another resident falls Do you push your pendant? No. You push theirs. Yes. Because if you push your pendant and you walk away, we're looking for you. So push their pendant so we can come find them. Who has their pendant on? Oh, good. Okay, good. If a resident is asking you to set up services, you don't do that, because then the agency is going to want your money. So, and I'm sure you don't want to pay for somebody else's services, so you can give them that information on that handout. So they or their family must set up private duty, or you can notify me, and then I can have that conversation with the resident or their family. If you think you need a higher level of care, so it's getting harder in your apartment and you think it's getting closer, or you want to dip your toe and ask questions because it's something you've never even considered before, but in the future you think maybe you might at some point someday need it, come talk to me, talk to Rachel. I keep an interest list, so if you have an interest, let me know. I'll put you on it. I put the date you had interest, and I keep notes. We can set up a tour. There's an assessment for assisted living and memory support. You have to qualify to move to those levels of care. We can discuss a timeline, but again, depends on your goal. If your goal is you're okay moving through the levels of care when you need it, great. If your goal is to stay in your independent living apartment as long as possible, then we'll go with that. If you think someone else needs a higher level of care, I'm sure we all know someone who needs a higher level of care, let me know. There's 463 of y'all. There's no way I can put my eyes on every single person. So let me know. Usually when someone tells me, Miss So-and-so, I think she needs more help, they're already on our radar. But it doesn't hurt to confirm what we already know or what we already think. We make notes and we keep them on our list. It's a process. It can sometimes take several weeks to months. That's why I do so much documentation, because sometimes families are in denial. So Miss Susie's daughter comes once a month, and when she comes once a month, Miss Susie is on her best behavior, and the daughter thinks nothing's wrong with her mom. But we see Miss Susie 24 hours a day, every day, and something's wrong with Miss Susie. So I have to keep all that documentation to be able to prove to the daughter that there is something wrong. So that's why we have to do all that documentation, to be able to prove why we possibly need a move. But be respectful and patient. This could possibly be you someday in the future, okay? So if you come to me and you're like, yeah, so-and-so is gross, and so-and-so, whatever. Just remember, we have to be respectful. We have to be respectful, because we could be in that situation someday, and we wouldn't want someone talking about us the way that we might be talking about someone, okay? Situations not compatible with staying in independent living: agitation, combativeness, aggression, delirium, psychosis, a danger to oneself or others, confusion, wandering outside the building, so walking in the streets, getting lost outside, incontinence that's not manageable independently or with a caregiver, impaired mobility, unable to transfer self independently unless you have a caregiver, severe dementia, unable to care for oneself, remember to eat, poor safety awareness, unable to use the emergency call system unless you have a caregiver. Admission to higher levels of care: resident has the needs the unit can assist with. The resident requires the level of care the unit provides. Again, it's not a hospital. And there's apartment availability. That's why I keep that interest list. As apartments open up, then we go down that list, how long they've been on the list, the needs, and residents that are willing to move. Some residents have been on the list a couple of years. Every time their name comes up to move, they're still not ready to move. So we go down to the next person. If you want more information about the healthcare center, rehab, assisted living, or memory, contact me or Rachel. We can set up an individual meeting, attend presentations that we have, and then I'm working on a transitions handbook. I just finished it today, and I'll be posting it on the portal soon. So on the portal, if you have access to the portal, if you don't, let me know and I can get you any of these copies that you'd like. So on the portal, you have to log in. It's not for the public. So let me see. Do you see, oh, it's tiny. Do you see this resource guide on the left-hand side that's in blue? Okay, so if you go to the portal, on the left-hand side, you scroll all the way down, it says resource guides. If you click on that, you'll have all these resource guides. So there's health and wellness amenities guide. So that's every amenity that we have here at Westminster based on the 8 dimensions of wellness. Okay? So that's physical, health services, volunteering. Oh my God, I just went blank. There's 8 of them. So if you look on there, it's everything that Westminster has to offer. I need to update it with our woodworking and our pottery group, or our pottery studio. The resident health services resource guide, so that's everything my department does. There's a pain management guide. There's a personal trainer resource, massage therapy resource. There's an internal resource list, so that's like audiology, rehab options, and then there's an external resource list, so things outside the community, like care management, pet walkers, and then I'll add that transition that just goes over what a transition to a higher level of care looks like. What if I have more questions? You probably do, because I can't possibly cover everything all the time. So call me, email me, come by my office. Hopefully y'all know where my office is. I'm over by the gym, by the bistro. Pop in. Any questions right now? Yes. She asked if in the guides I'm going to include pictures of some of the management. I did not. So leadership is on the website. The staff that are in my department are in my PowerPoints. So you could look at my PowerPoints that are on the portal. If there's particular staff, you could let me know if there's anybody in particular. Question, right here?
When you said you go to the portal, for resource guide, you first have to so right?
No.
And then that's under resource guide?
It's at the very beginning, but you have to completely log in.
Right.
And it's all the way on the left-hand side at the very bottom. It's not under social.
It's not under social.
It's at the very bottom of that whole list. Yeah. Yes, sir.
Where can I get a copy of your card?
I can get you a copy of my card. I should have brought some, I'm sorry.
Are they in your office?
They
If
are in
someone
my
stops
office.
by?
Yeah.
Okay.
Yeah, I can get you one.
Thank you.
You're welcome.
Robert, I want to go back to the beginning.
Oh,
Uh,
how far?
well, first 6 minutes. You said, you talked about coming back if you were ill and letting you know, et cetera, et cetera. But you're assuming the person's in the United States. If you're abroad and you either enter a hospital or have a medical procedure, obviously you have to work with the airlines. But do we call you as well? And if it's a weekend, of course, we'd leave a message because you wouldn't get the call till Monday. And such things as maybe being met at the airport with a driver if your driver's are not gonna work, and you need a little more assistance getting into the car, whatever. So what if you're abroad and you need medical service, you get it, but you have to come back?
Yeah, that's a great question. I haven't had to deal with that in the 7 years that I've done this, but we would figure that out. So if you notified me in advance, so what could happen is you call Westminster, so call reception, and you could say, I need Robin to know right away. The receptionists have my phone number, they have my cell phone number, and they could call me at home. If it's a severe emergency, they know how to get a hold of me. So I check my emails on the weekends, not 100%, but occasionally if I'm bored and I have nothing else to do, I will check my emails. But you can call reception, or if it's the middle of the night because you're in Paris or Rome or wherever you are, you could call security and whoever answers, and you could say, I need to get a hold of Robin because I need to talk to her, and they can call my cell phone. Yes.
Robin.
He's got a second question.
Well, just continuing on with that,
Uh-huh.
we have a program called Global Assist.
Okay.
So Global Assist might call Westminster.
Okay.
Is there some way you can alert people that receive phone calls on the general Westminster line that if it's Global Assist or something like that, could be American Airlines? And if that's the case, they want to inform you.
So what could happen is if you're going to go out of the country and you're concerned about that, before you go out of the country, you could sit with me and we can kind of come up with a plan. And what I can do is I can send an email to security and reception and just say, this person's going out of the country, they have Global Assist. If you get a call from Global Assist, call me right away.
All right, finally, I'm just now arranging with our funeral home.
Uh-huh.
And I expect that they will be notified, if you do notify them if I die.
Hope so.
And Global Assist would repatriate the body.
Okay.
Do you want to know?
Yeah, so we put funeral homes on your face sheet. So if you have a funeral home picked out, I do need to know because it goes on your face sheet. If you die overseas and your body needs to come back, then we will work with Judy to get your body back. I'm sure she wants you back, so we will work with Judy to get you back. We have a question right here.
Robin.
Yes.
I'm a new resident, and you have spoken about the portal.
Uh-huh.
I find that portal to be very challenging, and I have a master's degree. Is there any assistance with learning how to use the portal?
Yes. So you can read, there are a couple of options. One, we have a resident-led tech group that meets. Do we have any tech group people here? Not one. Okay. What days does the tech group meet?
The tech group meets in the game room on Wednesday mornings. I think it starts at 10 o'clock.
Okay.
You have to bring your personal device, but please bring your username and password, because if we can't log into the system, we can't help you.
So Wednesday mornings, 10 o'clock game room, bring your personal device, your login ID, and your password. So that's one. Another way is to reach out to either Ruth Sunil or Rachel Gill. They're going to murder me now that I've said that. But if the tech group can't help you, they can do one-on-one with you. Okay, great. Anybody else? Yes, Mr. Derniak.
I just want to tell folks I had the lucky, as a service to the community, I've tested about half of the things that Robin talked about today, and I want to tell you they work.
Thank you.
It's just, and if you've got questions, call Robin.
Yes, call me, yes.
Why don't you tell them where the game room is?
The game room, it's Mr. Shipman, right? Yes. The game room is over by the bistro, over there by the bathrooms. Okay, great. He's been there. Right under us. Library and bistro area.
Robin, there's a question about the handouts.
Uh-huh.
You said it's going to be on the portal, but not everyone can print it out from the portal.
If
Will you have
want
some
to,
copies?
if you want a copy, I will put this piece of paper at the exit back there, and if you'll write your name and apartment number, I'll have it delivered to your box.
Great service. My goodness.
Anything for y'all.
Is the Westminster 454 telephone number answered 24 hours a day?
Yes, it is. If for some reason it's not, because things happen, let us know. Okay. But yes, it's answered 24/7. We have one more? Two more? One more? One more. I'll take one more since we're past 3 o'clock.
I have a quick question, Robin.
Yeah.
Would you just reinforce when people go out of town,
Uh-huh.
whether it's overnight or for a week or 2 months,
Uh-huh.
that they fill out a form?
Yes, if you're going away from Westminster overnight, for a week, for a month, for 6 months, whatever, go to a reception desk and fill out the form that says you're going to be gone. We do a daily check-in, so that's where you push the little check mark in your bathroom that says you've checked in. If you don't do that, we are calling you and we're trying to find you every single day. Okay? And then we get worried if you don't answer your phone and we can't find you. So, if you're gonna be gone overnight, for a week, for a month, please fill out that form with reception so we know that you're not here. Thank you so much, I appreciate it.
Thank you.